Hello guys, welcome back to my YouTube channel. So in this video, we'll simply be looking at the gross anatomy of the axillary nerve. The axillary nerve is the major peripheral nerve of the brachial plexus. All right, so it has its nerve root as C5 and C6. So its motor function is that it innervates the teres minor muscle and the deltoid muscle. Okay, so in this video, we'll simply be looking at the anatomical cause, the motor functions, the sensory function, and also the clinical application, the clinical correlate. Okay, so like I said in the beginning, the axillary nerve is a major peripheral nerve of the brachial plexus. Okay, it branches out directly from the posterior cord. It it has its nerve root as C5 and C6. All right, so it innervates it gives its motor innervation to the teres minor muscle and the deltoid muscle. All right, so let's talk about the anatomical cause. Okay, the axillary nerve, it starts from the axillar part of the upper limb. Okay, so it is posterior. It lies posterior to the axillary artery and anterior to the subscapularis muscle. All right, so it has its nerve root, like as I said, it has its nerve root as C5 and C6. Okay, this is the nerve root of the axillary nerve. So it leaves the axilla through a space known as the quadrangular space. Okay, so this quadrangular space has boundaries. Okay, superiorly, it is bounded by the inferior border of the teres minor muscle. Then inferiorly, it is bounded by the superior border of the teres major muscle. So laterally, it is bounded by the surgical neck of the humerus, and medially, it is bounded by the long head of the of the tricep brachii muscle. Okay, then anteriorly it is bounded by the what? The subscapularis muscle. These are the boundaries of the quadrangular space. It is just a space that allows neurovascular bundles to move, to pass between the shoulder region and the upper limb. Okay, so the axillary nerve, alongside with the posterior circumflex humeral artery and veins, passes through this space, the quadrangular space, to get to the upper limb. Okay, so it's a space. So when there is a muscle hypertrophy and lesion in this space, it can lead to the damage of the axillary muscles that is being innervated by this axillary nerve will definitely be affected. All right, so those muscles, which includes the teres minor muscle and the deltoid muscles, will be affected. Okay, so moving forward, let's now talk about the motor functions of this axillary nerve. All right, so the motor functions of the axillary nerve, like we said, it innervates the teres minor muscle and the deltoid muscle. This is the basic muscle that it innervates. But before then, the axillary nerve divides into three different branches. Okay, you have the posterior terminal branch and the articular terminal branch, and also the anterior terminal branch. The posterior terminal branch gives motor innervation to the posterior surface of the teres minor muscle and the deltoid muscle. All right, so it also continues as what? As the upper lateral cutaneous nerve of the arm. This upper lateral cutaneous nerve of the arm innervates the skin in the lower part of the deltoid region, which is known as the regimental bandage area. Okay, so that is for the sensory innervation of the sensory function of the axillary nerve, but we'll get there. So like as I said, the axillary nerve bifurcates into three basic branches, the articular branch, the anterior terminal branch, and the posterior terminal branch. Okay, so for the sensory functions of the axillary nerve, like as I said, the posterior terminal branch of the axillary nerve, after innervating the teres minor muscle, it continues as the upper lateral cutaneous nerve of the arm. And this upper lateral cutaneous nerve of the arm innervates the inferior region of the deltoid muscle, the skin at the inferior region of the deltoid muscle, which is known as the regimental badge area. Okay, so that is for the sensory function, the sensory innervation. So the next thing we'll be looking at is the clinical applications of the axillary nerve. After talking about these nerves, we'll also look at the clinical application, the clinical correlate. Okay, so what will happen if this nerve is being damaged? Okay, what will be the clinical implication when there is a damage to this nerve? So, when there is fracture at the proximal part of the humerus, it can lead to the damage of the axillary nerve. So when the axillary nerve damages, it simply means that those muscles that the axillary nerve innervates is going to be affected. And those muscles include the teres minor muscle and the deltoid muscle. And the action that is being executed by this muscle is going to be affected too. So the affected arm will no longer abduct at the shoulder region beyond 15 degrees, and also externally rotate at the shoulder region too, at the shoulder joint. Okay, so this is going to be the clinical manifestation when there is damage to the axillary nerve. All right, so another thing is that there will be loss of sensation at the regimental badge area, which is the inferior part of the deltoid muscle. Okay, the skin at the inferior part of the deltoid muscle, there will be loss of sensation there because the upper lateral cutaneous nerve of the arm, which is also a branch which is also coming out from the axillary nerve, has also been affected too. So there will be loss of sensation at that point. Okay, so that is the clinical correlate. So another clinical correlate is Erb's palsy. Erb's palsy is just a clinical condition when there is a damage at the C5 and C6 root of the brachial plexus. And like we said from the beginning, that the axillary nerve, the nerve root of the axillary nerve is C5 and C6. So when there is a damage at this point, okay, it's definitely going to affect the axillary nerve. All right, so the clinical manifestation of Erb paralysis, of which is Erb palsy, will also be presented. So these are the two basic clinical implications of the damage of axillary nerve. Okay, thank you guys for your time. Thank you for subscribing to this YouTube channel, because I know that you've already subscribed. So God bless you. Thank you. Keep being focused. Keep doing your best. As time goes on, we'll definitely reap the fruit of our labor. So thank you. Subscribe. Tell your friends to subscribe. Tell your loved ones to subscribe. I really appreciate it. God bless you. Thank you for your time, and thank you for your patience. More videos will be coming in. More subsequent videos will be coming in from anatomy, physiology, and biochemistry. Thank you. Peace.